The second scan taken in office is a thermography scan. Thermography is the analysis and interpretation of temperature. In chiropractic, as our focus is neurologically based, our analysis of thermography is based on the surface of the spine. Now, the spine serves its purpose of protection. It protects the nervous system that resides within the body. Now, the nervous system is responsible for the brain's communication to the body and the body's communication to the brain, meaning that the nervous system is essentially the air traffic control to how the brain and body communicate together. In the event the brain cannot communicate to an organ or a muscle or tissue properly, that system will no longer perform properly. In the event that that organ system cannot communicate its needs to the brain, then that organ no longer performs or acquires its ability to heal itself. Thermography in a normal analysis is shown here on the left, where white indicates no clinically relevant difference in temperature. Our thermography scans have two separate scales that are measuring left to right on each vertebrae, essentially two scans on each side of the spine. Now, when we are measuring these areas within normal limits, there would be no temperature difference within the vertebrae themselves, meaning that the nervous system's performing in its ideal scenario. When we look at it side to side in this example, red shows significant disturbances or differences in temperature. This is how we identify geographical locations of subluxation patterns. Now remember, a subluxation is a misalignment of a vertebrae that impedes normal neurological communication from the brain to the body. When you see red on a scan, that shows a large indifference. Now, based on the location of where that subluxation occurs, it aids with our interpretation to understand where neurological distress occurs. The higher in the spine that subluxation presents, the more effects it has on the autonomic nervous system. Now, in this example here, where you see red at the top at C1, this area shows disturbances of nerves that communicate to other organs and systems other than just that region at the upper neck. Now, within this, you'll see other patterns and clumping, where you see a disturbance here in the neck and then over here in the mid to lower spine. So when we're looking at these areas, we are searching for patterns and we're looking for symmetry. Now, when we look at it left to right, this is going to help us to understand where to focus our initial adjusting sequence on. The second analysis is where we are studying it top to bottom. So think of the DTG scan as a depth finder. Where is the subluxation at its most chronic duration? Now, in this interpretation, the largest area is at the C1 segment again, which shows that when subluxation resides for a chronic length of time, we can measure that disturbance with the thermography scan. What is normal is to have the upper spine its warmest temperature, the lower spine its coolest temperature. You should see normal where red pushes out on every segment. And if we're seeing blue that pushes in, it allows us to understand where the subluxation pattern has been residing for a longer period of time and helps us to localize different systems of the body to interpret change.